I'm Dr. Peter Durman. I'm a minimally invasive and endoscopic spine surgeon at Texas Back Institute. I'm a surgeon. I love to do spine surgery. It's like a thing I have to admit. But I try to help people avoid spine surgery if at all possible. And for me, being a minimally invasive surgeon, that's partially a philosophy, which is trying to create the least invasive plan we possibly can to address the patient's symptoms. Many of the times, that is not surgery at all. So the least invasive surgery is no surgery, and that's always my goal going in when I first meet a patient. And so we think about things like physical therapy, sometimes chiropractic care, anti-inflammatory type medications, unless there's a reason a patient can't take them. That's kind of round one. Round two is thinking about injections, and sometimes injections can be beneficial. There's different kinds of injections. And then if that doesn't help or isn't sufficient at providing, significant or long-term relief, that's when you start thinking about surgery. And so what I would say is, if a patient's symptoms are bad enough that they're impacting their quality of life, or if the patient's thinking about, should I do this activity that I like to do because I'm gonna really pay if I do this, that's when it's worth at least getting checked out. And going to the spine specialist doesn't mean you're necessarily going to have spine surgery. If you find a good conservative spine surgeon, it's important that they work you through these steps. But if you've gotten through all of those steps and you're still limited, and it's a problem that's amenable to surgery, then that's when I think undertaking a surgery makes sense, and that's where my job comes in to figure out what's the smallest thing that can possibly